In Nigeria's capital city, Abuja, the third Africa Medical and Wellness Expo brought together a powerful convergence of ideas, innovation, and leadership. This program is in partnership with the Federal Ministry of Health and Social Welfare, the Federal Ministry of Art, Culture, Tourism, and the Creative Economy. CityV's 𝐀𝐟𝐫𝐢𝐜𝐚 completes the report.
The third Africa Medical and Wellness Expo, which was held from August 27th to 29th, 2025 at the �W𝐞𝐝 Luxury Hotel, had the themed Medical and Wellness Tourism, Building Global Healthcare Gaps. The well-attended event attracted participants from across Africa and beyond, including healthcare professionals, policymakers, military officials, private investors, and development partners, all focused on advancing Nigeria's role in the global health and wellness sector. In his address, the convener of the event, Mr. Usman Issa, raised serious concerns about Nigeria's health sector, pointing to poor access to quality health care and the shortage of medical facilities. He noted that many Nigerians view the system with doubt, yet he emphasized that the sector holds vast, untapped opportunities.
This year's theme, Medical and Wellness Tourism, Bridging Global Healthcare Gaps. It is more than a theme. It is a crowd call for action, equity, collaboration, partnership. We are here not just to talk, but to act towards closing the gap that denied millions access healthcare quality and specialized medical treatments simply because of where they are born or live.
The keynote speakers emphasized the urgent need for investment in healthcare infrastructure, calling for stronger public-private partnerships to bridge gaps in access, equipment, and specialized services.
Bridging global health gaps speaks to reducing inequalities in access, affordability, and outcomes. Medical and wellness tourism contributes to this by providing access to care beyond borders. It allows patients to seek medical help in areas where they can afford. Services may be scarce at home, and so thereby promoting global equity. Investment in local health systems is one of the things we're talking about here, because medical tourism strengthens hospitals, training institutions and infrastructure, and ends up benefiting the local populations.
You know, we have a growing, aging population. That is to tell us that we can invest in the geriatric healthcare industry. And of course, people are living, you know, a fast-paced kind of lifestyle, that obesity and other forms of problems develop. And so wellness tourism and alternative cures, we can look at those areas. Other opportunities are, you know, shortage of supply in the national health system.
Officials from both partnering ministries reaffirmed their commitment through the federal government's renewed hope agenda, citing ongoing projects aimed at modernizing public health institutions nationwide.
The Armed Forces of Nigeria is very passionate about provision of very affordable and quality healthcare, not only for the members of the armed forces and their family, but also for the civilians and the civil populace alike. Apart from the security and military duties, the health matters are given a very high premium in the armed forces.
President's Renew Hope agenda have taken bold steps in providing modern equipment in our tertiary and secondary medical hospitals to meet world-class standard, and government policies have created enable environment for huge investment for private investors to build world-class standard medical outfits to be established around the country.
While speaking with the press, Mr. Usman Issa outlined an immediate action plan set to be activated, aimed at unlocking opportunities in medical tourism and strengthening healthcare delivery systems.
The government should make a policy, because there are many of our local healthcare service providers that are doing wonderfully well that are not known. And we bring this platform for our local healthcare service providers that render specialized medical treatments that are doing well in Nigeria that people don't know about them. We have seen that it's a time, you understand, to be known.
Other participants who spoke with CTV urged the government to provide greater support to stakeholders in the sector, reinforcing that Nigeria is fast becoming a viable destination point for medical and wellness tourism.
Africa have 4 gates. The north is Egypt, east is Kenya, south is South Africa, and the west gate of the African continent is Nigeria. So Nigeria itself is with the population and growing economy. That is the best place to be started in Africa. That's why I'm here.
Medical tourism is a very complex situation, but Nigeria is making progress in reversing the external tourism. People are now coming into Nigeria to receive specialized medical care, and that from outside the country, and also using that as an opportunity to explore, what is available in Nigeria, health-wise and otherwise. So it's an improvement, but it's still a far cry from where we're supposed to be. And there are a number of reasons that are driving that, but the government is addressing them.
A lot of awareness campaign, a lot of enlightenment program has to be done so that people will now know that, yes, medical tourism is for real. It's not only for us to even go to other countries to avail ourselves of that opportunity. It is also time for other communities to start coming to Nigeria and bring in the foreign exchange. So, to boost our economy, we are not the only one that should be losing money. We should gain some money and add to our own economy and make the life of an average Nigerian better.
Highlights of the event included a performance of the spoken word and a panel discussion on the theme. The expo ends with hope that by building bridges in global healthcare, Nigeria can emerge as a leading hub for medical and wellness tourism. In Abuja, 𝐀𝐟𝐫𝐢𝐜𝐚 reporting for CTV News.